Thanks for the introduction and happy to be here. I was born and raised in Hoboken, New Jersey, so it's nice to talk to the home state audience. I'm going to share my screen right here. Okay, so today I'm going to talk about how my team at Johns Hopkins adapts public health messages into content for social media. And hopefully some of these tips are things that you can use with your own communities. A lot of my examples today are going to be focused on Instagram, but the lessons behind them are broadly applicable on basically any social platform. I'll also get into a little bit about how our strategy on social media at the School of Public Health changed over the course of the pandemic. So we'll get right into it. There's a lot of slides, but it's a lot of screenshots, so bear with me. So let's start by clearly talking about what our goals and our approach here at the school entails. I would describe our approach on social media as, broadly speaking, we are trying to share key public health messages. We are trying to ladder them so that no one piece of social media content needs to get every part of the information out there. It all ladders up to the key messages that we're trying to reinforce. So one example of that might be maybe the key message is schools can open during the pandemic if certain precautions are taken and if certain things are done to make the classrooms more safe. That means that a piece of content that ladders up to that might focus, say, just on ventilation. It doesn't have to focus on every single thing that makes it safe. Similarly, a lot of our focus has been on translating the science. So as you can imagine, it's breaking down for everyday people what like the R number is or what airborne actually means. A lot of the content that we produce is informed really just by things that we see people asking in our own social media comments. So on posts that we've published, on posts that other entities in the health space have published. Frankly, a lot of the stuff that we've posted has been informed by questions that our own neighbors asked us when we were getting the mail. Like if they're wondering it, chances are everyone's wondering it. So we might as well talk about it. And we're always trying to develop content that is actionable. So it's what can someone actually take away from a post and incorporate into their own lives? Maybe if that's just as simple as reminding them that they can order rapid tests through the mail for a second round now that it's available. And then this part was touched on by some of the other presentations, but it's a really big key, which is often the content that we're producing, we're trying to create talking points or resources that a person who sees the content can then go use in their everyday life. We think big picture around who's following a School of Public Health's Instagram account, for instance, or who's following a health department's public health Facebook page. It's likely someone who already kind of agrees with you. They went through enough steps to follow your page, so they want to see your updates. You can take as a given, for instance, that people who follow the Johns Hopkins School of Public Health Instagram page are probably all or mostly vaccinated. So our focus on our content is less to motivate that person in our audience to get vaccinated and more so to equip them with what they need to maybe talk to their cousin about getting vaccinated. It goes back to what the previous presentations have said about how the trusted messenger is really the key. And then as everyone else has done over the last 2 years in particular, a lot of our content is focused on debunking misinformation or also pre-bunking. So a prime example of this as we wait for the vaccine for under fives to be authorized is we're already starting to think through what sort of is the likeliest line of misinformation that will come out when that's authorized. It's going to be obvious. It's going to be, what took them so long? It's not tested on kids. What other vaccines are given that many doses to kids in a short period, et cetera. So we're already sort of pre-bunking that information by getting some content out there to address that early. And so that's the big picture, but to talk through the actual goals, what we're doing with every single piece of content we publish, this on the right is a Instagram story slide that we published about getting over your fear of needles if you need to get a COVID shot, is we're trying to inform, entertain, and motivate people to share it. What prior panelists have said is true, which is when you're on social media, you need to be cognizant of the fact that your posts are not being seen in a vacuum. They are being seen alongside a post from ESPN, alongside something from the Kardashians, alongside my cousin's wedding pictures. Like, I need to grab someone's attention very quickly because I will otherwise be buried in far more entertaining things. And so what we do here is, on this typical piece of content, we're trying to do all three of those things at once. We're trying to inform, entertain, and motivate. And what that means is, someone might see this post and think like, oh, I'm afraid of needles. I'll check out this post and maybe help myself. And someone else might just latch on to the illustration and think that's cute and share it with their friend. And then a third person might see it and think like, my partner needs to see this, and I'll send it to them. That goes back to the to resources for conversations goal that I was talking about before. It's great, if we only ever inform the audience member on resources that they need to overcome their fear of needles. But raw numbers, that's one person who we've helped. Whereas in these other examples where someone shared it because they like the illustration, or someone shared it because they know someone who could benefit from it, now we're starting to snowball our audience and reach more than just one person in our follower base. We're reaching outside of our follower base and informing more people. So all of our content is always striving to do all those things. And then as you continue to do this, so this on the right is another Instagram story post we did after Drake released his newest album, and we used it as an excuse to publicize the fact that pregnant people could get the vaccine safely. This post got shared, and I can't imagine that a more straight-laced, button-up version of this post would have been shared. So when you create things with the intention of your audience sharing it within their own networks, you build a durable audience, and not just for your own brand, but for public health in general. So big picture here at the school, my team runs 5 English accounts, 1 international account. We've got a combined follower base of 1 million followers across all of them. We publish around 65 times a week. Most of those occur on Twitter. And then each week we reach between 5 and 7 million users organically. And our audience grows about 0.5 percentage point each week. And what the important numbers here are is this one. So you don't actually need to be worried about your actual follower size. What you want to be following closely is how many people beyond your followers you're reaching. Because if your goal is to get people to share your content, that's how you're going to know. So what this tells us right here is that on each week, for every 1 follower of ours who sees our content, between 5 and 6 million or 5 and 6 other people who don't follow us are seeing our content, and that's the goal. So how have we changed over the course of the pandemic? In December 2019, this was our Instagram page. It looks a lot like what you would see at basically any school or academic unit in the country. It's a lot of student profiles. It's a lot of events coverage. It was good, but it was geared mostly to an audience of prospective students who we wanted to see something appealing about the school, see themselves in that path, and then become degree-seeking students here. What we started to do starting very soon into the pandemic was we were confronted with some challenges. I mean, like everyone else, we went remote. We immediately ceased having on-campus events. We couldn't use archival photos because no one had masks on. So we had to go to a more illustrated style. And our early effort, it was interesting when I was scrolling back to get these screenshots, they're very text heavy. They were, rapidly designed. They were not super fancy. A lot of our efforts were designed to promote like articles or events. And what we found over time was that was doing okay, but we wanted to better serve an audience who we acknowledged would never actually become students here. So you have to think back to early 2020, what was happening around then as the pandemic took off in the US. There was a real dearth of good quality, easy to understand information from official sources. And so we kind of viewed that as an opportunity to do all of the things that I began my presentation with, like dispel misinformation, share news you can use, et cetera. And as we started doing that, and as we started doing that more often, we realized that it's okay if our audience is people who are never going to actually be students here, because if they're sharing it out in their own networks, someone they know might end up being a student. And it has paid off, because at last count, I think 14 of every 15 followers of ours on Instagram has joined us since April 2020. So the audience has grown enormously because of this strategy. And so moving ahead to September, you can see we started to go fuller bore into illustrations, less text dominant. We also started, if you can imagine a dimmer switch, we started dialing up a little bit of the humor associated with some of the content. So this top right picture or the bottom right video, those are both pretty tongue-in-cheek, pretty funny. And the reason we did that is, again, going back to the importance of sharing, that kind of stuff is more engaging. People are more likely to take their medicine if you give them sugar with it. It's every parent knows that. So the fact that we had to go to an illustrated mode sort of naturally led us in the direction of humor, because you can only draw cartoons so often before your sense of humor kicks in. And our general rule of thumb was we're never going to punch down with our audience. So we kept humor pretty light. Imagine like stereotypical dad joke more than anything else. And so that's been our sort of compass direction ever since. And so December 2021, this was more recent, sticking with the humor, using more meme content, but also, as you can see, starting around the end of last year, we began to distribute some of the lessons that we learned on how we communicated COVID guidance and take those lessons to talk about non-COVID topics. So the top left picture on the right screenshot is about PrEP. And the bottom middle one was about the flu shot. And so we began taking some of the approaches that are tried and true over the last 2 years, talking about, the greatest public health event of my life, and instead just started taking those lessons to talk about these other topics that we suspected our audience might want to hear more about. And that takes us to more to today. Still visual, still occasionally having fun, but also sharing important information, and also talking more about issues that are not as explicitly related to COVID. So gun violence, for instance, skin cancer risk, et cetera. And what makes our content successful, in my opinion, are a lot of the decisions that we make both in the planning and the production stage of the development. And these are lessons that I think everyone can take to heart. So we'll start with the big decisions. You need to really think through a couple of key things before you even set out to create anything on social media. This goes for illustrated graphics, written text, videos, anything. And you start immediately with, you need a message. So a typical message, just a hypothetical on the right, might be, COVID-19 vaccines are safe and effective. But as I was saying at the start of this presentation, no one piece of content that we produce is going to fully convince someone of that message. We need to, if you imagine like splitting it off into atoms, we need to hit that message from a lot of different perspectives, because one point about it might move someone, and that same point might not move another person. So we need to make sure we try a couple different avenues. And so what you can do is you can imagine your content, each piece of content, as sort of supporting evidence for that message. And so, for instance, maybe you do one post about how vaccines prevent severe disease. You do another post the next day about how the vaccines were rigorously tested during Operation Warp Speed, didn't skip any safety trials. And then you do a third one maybe a week later about how getting COVID-19 itself is more dangerous than getting a vaccine. And then you go even further. If now you imagine like the Fantasia scene where the brooms are splitting into more and more. So maybe we want to ladder up to the COVID-19 vaccines are safe and effective, and we want to convince people that the truth that COVID-19 is more dangerous than a vaccine side effect could be. But we need to make maybe one piece of content about that evidence for the audience for whom it's most true, which is maybe people who are older and at higher risk. But we need to also make a version for people who, for them, it may not be the case that COVID-19 is an acute health threat, or at least they don't think so. And in that line of reasoning, we might have better success with content that appeals to their sense of community, appeals to their sense of family responsibility. Maybe they need to get vaccinated so that they can more safely see their grandparent, things like that. We also need to, before you make any content, decide where your audience is. This is a key that a lot of people, I think, take for granted without really thinking through. So on the right is a breakdown, according to Pew Research, of what % of Americans use each of the major social networks. And I think in all my years of doing this, the biggest misconception that I've encountered among health communicators is they get very enamored with scale. They see a chart like this and they think, well, everyone's on YouTube and Facebook, we need to be on YouTube and Facebook. But what's hidden in those lower numbers down below is that maybe your audience is actually the one that's on WhatsApp. Maybe your audience is the one that's on LinkedIn. Each of these networks has demographics that are more associated with it than others. For instance, Instagram skews younger than Facebook does. And so that's one way to think about it. And then the other way to think about it is you need to go where you have something to add. If I am never going to create a compelling video of myself dancing in my laundry room talking about health information, maybe I shouldn't be on TikTok, things like that. To give it a geographic example, this is what one way we've convinced our faculty here of this is, if my goal was to reach people in the Mid-Atlantic and I had a choice of going for one audience that had 14 million people in it and another audience that's 600,000 people in it, some people would immediately say, let's go for the 14 million one, but they wouldn't ask the key question of who those people are. And so in this example, 14 million people represents the population of Tokyo, Japan, and 600,000 people represents the population of Baltimore City. And my goal was to reach the Mid-Atlantic, and I don't speak Japanese, I speak English. So obviously I should be going for the smaller one. So that's sort of how you need to think through these social networks. Again, like I said, you need to know what you have to offer in terms of your format. If you don't have visual capabilities like graphics or videos, Twitter might be the place for you. If you don't have links to share, maybe Twitter's not the place for you. Maybe you need to be developing more original content for something like TikTok or Instagram or even Snapchat. And you also need to make sure you show it to the right people. So again, these are all the information, these are all the 4 key considerations you make before you even post anything. And so this on the right is our Facebook data showing when followers of our page are online throughout the day. And it shouldn't surprise a lot of people that 9 to 12 and 6 to 10 p.m. on weekdays are the most popular time for most people to be on social media. If you think through when you yourself catch yourself sneaking looks at social media, that probably tracks. And so we think through, like, maybe we want to publish our content during one of those peaks or during one of those valleys, depending on who we think might be online then. And all of that's an important consideration to make. You also need to really pay attention to your workflow. So this is when we actually are making content. I'm going to walk you through how we go from a concept into a post right here, based on what, like, the workflow we've arrived at over the last 2 years. And so pretty much everything we do begins as a script we use Google Docs, you can use whatever. But we write this out well before the content gets designed or produced. And the key here for review is we have our team here at the school, which is primarily people with non-science backgrounds, creating the general flow of the content, and then we get that fact checked and through technical review using trusted faculty. Occasionally we use postdocs, but we've over the last 2 years assembled like a stable of trusted advisors who can give this stuff a read, and we show it to them in script form because I don't actually want their feedback on the graphic design. They are not, even the health communicators are not experts on design. And I don't want them to get distracted on things like use a different color here, use this kind of whatever. We want them focused on the science, and we want to be focused on the design parts. So we used that script that I just showed to rapidly produce a piece of content. On the top is a square post that we use for Facebook, Twitter, and Instagram feed. On the middle row is Instagram stories, and then a horizontal one. But we laid them all out at the same time, and we have it basically down to a assembly line effect at this point, where we design everything at once based off of the blessed script, and that allows us to move really quickly. So Johnson & Johnson, their vaccine was paused. The distribution of it was paused at one point to investigate a health signal. We were able to publish a piece of content explaining what people need to know about that the same day, because we were able to move so quickly in this tried and true approach. And so the other useful tip to think through is there's a concept called the curiosity gap, which has a bad rap because it's associated with clickbait. But on social media, what it means is we were publishing a carousel of, I think this one was 7 images. We need people to click through. And so we don't want to give all the information necessarily up front. Obviously we want to make it accessible, but we begin with a first slide titling it this way to sort of engage a person's innate interests. Even if they didn't get the J&J vaccine, they might want to know based on this sort of provocative approach that we use. This is an example from another post, but we did a post about the CDC's updated travel guidance, and on its face, that's a very boring concept for a lot of people. If I'm not traveling anytime soon, I don't generally want to read about that. So what you can do to sort of engage people's interest there and stop them momentarily on their scroll is just play up the graphic, do something novel in the illustration. In this case, we added a face mask to the airplane itself, and it's enough for people to think like, oh yeah, I'll check that out. And so on that note, there's a lot of little micro decisions you make. I'll go through these next ones pretty quickly, but here are 3 typical Instagram posts, ranging on the left from what I would consider to be our more buttoned up serious approach. In the middle, maybe more approachable design, but still content pretty serious. And then on the right, what I would consider like not necessarily a meme, but like a very funny, arresting, tongue-in-cheek one. But what you'll notice is that all 3 rely on the same brand colors and fonts. They're all recognizably ours. And that's important when you're establishing trust, because if you're all over the place, if your content never resembles itself, people aren't going to necessarily trust it as much as if you have like an established look and if not tone, but like an established approach. And on the right, we're judicious with examples like this. We're not all funny all the time. The reason we use it once in a while is just for the novelty of catching someone a little bit off guard. Like if I'm a student and my university tells me to get a flu shot in an email, that's one thing. But if my university publishes a meme with a rapper telling me to get a flu shot in a parody song, it's caught my attention in a little bit more of an active way. These same approaches work on video. So these 3 examples are video examples. On the left, very serious. With video, you have some liberties to play with that you don't in static graphics. So a slow video with somber tone is going to be different than a faster video with like quick cuts. Then, on the right, an example of a video that's very off the wall. No comment on who the clown is, by the way. And so the other thing that's notable here is in the first 2 examples, we did what I said before. We stuck to our templated graphics, our font colors, our brand guidelines, etc. When we went truly funny on the right, we actually diverged from all that. And part of the reason for that is because we wanted to play up the momentary novelty or confusion of someone seeing that and thinking, did Johns Hopkins really post this? Because that's a valuable piece of, or way to hook people's interest, that sort of uncanny playing with their expectations. And so I'll bring it home here and talk about, a successful example going back to what we talked about before with the Johnson & Johnson vaccine pause. So that piece of content, we published it the day that the pause happened. We went out of the gate really quickly. with it. And because of that, over a couple days in April, that post reached 60 million users on Facebook organically. It drew, over 1 million engagements, tons of comments and shares. And we know that at least one of the people who engaged with it works at the CDC, because the next day the CDC published their post on the bottom, which very closely resembled ours. And we take this as a compliment. Imitation is a form of flattery, but it was very interesting to see that we effectively went out of the gate faster than the big guys. And so, a couple closing thoughts. I know I'm standing between us and the talk or the questions is, it's important to know your messages and to stick to them. It's important to create content that supports those messages, but that people actually want to share. That's the key. You want to create content that people want to share, because if you do that, peers sharing content is going to be more powerful than brands broadcasting it. Your fans or the page followers will become ambassadors, not just for you, but for health messages. They're more trusted than you ever will be. And they're going to be able to reach the people who most need to see it. Like I said before, it's not very likely that someone who is truly on the fence about getting vaccinated is going to follow a school of public health Instagram account. It's more likely that their sister follows us and is going to share that post with them at the time they most need to see it. And also, if you design for sharing, the platforms do reward you. Back to the prior presentation about engagement and measuring engagement. The fact of the matter is, on every single social network, the more something is liked or shared, the more people will see it on the platform. It's just the way that all of these work. So it's in your interest, not only just from a messaging standpoint, but from a technology standpoint, to do this way. Thanks a lot, everybody. Happy to participate in this talk and also the Q&A later.